Hello doctors, today we will talk about urinary retention surgery. Here the doctor begins by creating an insertion in the post-scrotum space in order to bring the back part of the penis out. Here the doctor begins to remove the membrane surrounding the penis so that he can reach the location of the blockage. Here the doctor was able to determine the location of the blockage. Now he opens the dorsal surface of urethra area. Why? Because the upper part of the urethra has muscles, it will heal after the operation and will not affect the narrowing of the urethra, but it is not possible to make an opening in the lower part of the urethra because it does not have muscles, and after healing it will cause narrowing of the urethra. Oh my God! This small stone is the cause of the blockage. Now the doctor is opening the ventral abdomen area so that he can release the retained urine. Wow, that's really a lot of retained urine. It's like a bomb. The doctor inserts his hand into the opening so that he can remove the urinary bladder. Then continues to remove the retained urine. Here the doctor uses a size 12 rail tube. He inserts it from the urinary bladder so that the doctor can ensure that the urethra is clean and free of obstructions or stones. It is inserted from the urinary bladder and then passed through the urethra through the area from which the stone was removed. Here the doctor takes out the small stones and debris causing the blockage. Then the doctor continues inserting the rail tube into the urethra so that it reaches the penis. Here the tube came out of the penis opening, then the doctor moved it to make sure that the urethra was clean and free of blockages. The doctor pumps the saline solution into the urethral tube to ensure that the urethra canal is clean and free of any blockages. The doctor begins by suturing the hole from which he removed the stone causing the blockage. The doctor uses saline solution for cleaning.
Here the doctor begins to sew the front of the rail tube to the front of the penis. Doctors, you should focus on this point. Here is an important question. Why did the doctor leave a large part of the thread and not cut it? So that he can remove the rail tube after the animal has recovered by tightening this rope. Here the doctor cuts the sides of the tube to provide a larger space to carry urine from the urinary bladder for urethra. In order for the rail tube not to cause blockage and to allow urine to pass through these openings easily, so that urine does not pass through the urethra directly into the wound and cause contamination and some problems. Here the doctor begins to sew the hole through which he inserts the rail tube into the urinary bladder. Then the doctor uses saline solution to disinfect and clean. He even does washing of vessel using saline solution as well. Then he removes the excess fluids in the vessel using gauze to reduce the accumulated fluids and urine.
Here we use oxy medication at a concentration of 10 and then add a salt solution to it to disinfect the viscera internally. Pickrell solution is also used after oxy for disinfection. Here the doctor begins to sew the muscle layer in the ventral abdominal opening. After he finished suturing the muscle layer, he begins here to stitch the skin layer and make some stitches so that he can completely close the wound. Here the doctor begins to sew the hole in the post-scrotum area, so he begins to sew the muscle layer first. Then he completes the stitching of the skin layer. Then he begins spraying iodine to externally cleanse the skin. Finally, 15 days after the operation. Here, after passing by 15 days, the doctor begins to remove the surgical sutures, after the wound has completely healed in the post-scrotum and ventral abdomen area.